Hi, my name is Ashley Van Buskirk, and today I'll explore low fat versus low carb diets and what research shows truly matters for heart health. Heart disease remains the leading cause of death for men and women in the United States. So when we ask whether low fat or low carb diets are better, we're not just talking about weight loss. We're talking about long term heart health and saving lives. For many years, people have debated which diet is better for losing weight, low fat or low carb. Low fat diets became popular first. The idea seemed simple. Fat contains more calories per gram than carbohydrates or protein. So if you eat less fat, you eat fewer calories and you lose weight. In the mid 1900s, studies also suggested that low fat diets may help prevent heart disease. This made low fat diets even more popular. Soon, grocery store shelves across the United States were filled with fat free products. But as nutrition science evolved, researchers discovered something important. Not all fats are the same. Some fats, especially those from plants like nuts, seeds, and olive oil, are not only healthy, but essential for our bodies. So while we shouldn't eat excessive amounts of fat, eliminating fats from the diet entirely isn't the answer. Then, in 1972, a cardiologist named Robert Atkins introduced a very different idea. Instead of blaming fat, he suggested that carbohydrates were the real problem. His approach, later known as the Dr. Atkins diet revolution, proposed that if people drastically reduced carbs, their bodies would switch to burning fat for energy. By the early 2000s, research also began showing that low carb diets could indeed help with weight loss and might even improve certain markers of heart health. Since then, many popular diets have followed similar low carb principles. But here's the challenge. Past studies comparing low fat and low carb diets have shown mixed results for heart disease risk. Why is that? Well, perhaps because both diets can include either healthy or unhealthy foods. A low-carb diet full of processed meat and butter is very different from a diet rich in vegetables and plant proteins. The same is true for low-fat diets. Researchers wanted to look deeper. In a long-term study, including over 200,000 participants followed for more than 30 years, individuals completed detailed questionnaires every 2 to 4 years about their diet, lifestyle, medications, and health conditions. Rather than simply labeling diets as low fat or low carb, researchers categorized them as either healthy or unhealthy. Unhealthy diets included more animal fats, processed meats, refined grains like white bread, and foods with added sugar. Healthy diets emphasized plant-based proteins and fats, vegetables, whole fruits, beans, and whole grains. By tracking these patterns over decades, researchers could see how different food choices affected long-term heart health. The results were clear. People who followed healthy low-fat or healthy low-carb diets had a lower risk of heart disease. But those who followed unhealthy versions of either diet had a higher risk. The key finding, it wasn't about cutting carbs or cutting fat. It was about the quality of the foods. Expert reviewers noted that these results align with decades of research encouraging a shift away from focusing on single nutrients and toward whole dietary patterns. The healthy foods highlighted in this study are the same ones emphasized in well-known eating plans, like the Mediterranean diet and the DASH diet, both widely recommended for heart health. So what does this tell us? Food quality matters more than simply reducing carbohydrates or fat. Instead of focusing only on macros, we should focus on eating whole, minimally processed, and nutrient-rich foods. In the end, it's not really about carbs versus fat. It's about making smart, sustainable, healthy choices every day.